Good afternoon. I'm Dr. Tim Bagwell, Public Administration and Policy Analysis faculty at Lincoln Memorial University, Harrogate, Tennessee. Today, I'm speaking with Dr. Loralie Ma, MD, PhD, FACR, that stands for Fellow American College of Radiology, and the president of the Maryland Medical Society. Dr. Ma, welcome to Lincoln Memorial University and our class on strategic communication in healthcare.
Thank you for having me.
Thank you. Dr. Ma, tell me a bit about yourself. How did you enter the profession and eventually become leader in your field professionally and eventually to the position as president of the Maryland Medical Society?
Well, when I was young, I was always interested in biology, but my parents wanted me to do more of a science degree in engineering. And so I went to the University of Illinois at Champaign-Urbana, and I started off in electrical engineering and then switched to biophysics. And then during that time, actually, I joined the Bioengineering Society and became vice president of the Bioengineering Society. During that time, we did some really great things. We worked on devices for wheelchairs to make them more usable on buses and the such. We actually worked on some Braille translation things for the blind. And I really realized that I wanted to help people and I wanted to work in medicine. So I had already been accepted at that time into the PhD program in biophysics at the University of Illinois. And I went to the School of Life Sciences director. And when they spoke with me, they realized that, there might be something for me that I could do both. And so I was actually entered into the medical scholars program, which was an MD PhD program. And within a week, I was entered. And within about a month, I had been accepted into the medical school at the University of Illinois. And that's how I came into medicine. I ended up in radiology because I think it was a good match between my desire to do science, and imaging had a lot to do with science, but at the same time to do things that help people directly, like looking into the body and seeing what's wrong, whether it's, a brain tumor, a stroke, a meniscal tear, appendicitis. And I think those are, very interesting things, for me personally. At the state level, I really became involved first with the Maryland Radiological Society, and that's my state specialty society. And I liked it. I became president of that society back in 2007. But over time, I realized that unless you're really involved with all of medicine and that you really speak as physicians with one voice, that you don't really have the power to affect change. And so I realized that I really wanted to get involved in my state society. So I got involved first with my Baltimore County Medical Society, which is our county components, and then with the State Medical Society.
And so that led to eventually to an election to head up the medical society.
Right. So I at first in the county medical society, I became the president, and that was back in 2015. And then I started on the legislative council at the state level, because I really realized that legislators are really looking to medicine, to doctors, to help them to know in terms of healthcare legislation what's the right thing to do. And so once I got involved with that, then I sort of started up on the track, and that took about 10 years. And so, well, I guess a little bit less than that, but I became the vice speaker of the House, then the speaker of the House, and then president-elect. And then this year I'm president of the State Medical Society.
The organization kind of mirrors the legislature to a certain extent, I guess.
Right. I think a lot of organizations are like that. We have our county components, then we have our state, and then obviously the state, is under the national component. So.
Excellent. So that actually leads to the next question I had. Tell us about the society, the Maryland Medical Society. What is its mission and how it relates to the AMA?
Well, we're one of the oldest medical societies in the country. I'm the 174th president, so we've been around for at least 174 years. We are actually called MedChi, the Medical and Chirurgical Society, because of our medicine and surgery. So we call ourselves MedChi. And we are, our mission is to serve as a resource to physicians in all things in terms of their medical work, their medical education, to advocate for them in the state and nationally, and for them to help them really be able to practice so that they can best help patients.
Excellent. Thank you. What kind of activities have you been involved in at the state capitol at Annapolis?
I've been at Annapolis a lot, over many years, actually starting back in the early 2000s. So about 20 years now, I've been going almost every year, multiple times. Every year there are numerous bills, hundreds of bills that have to do with healthcare. And the legislators that are in the Health and Government Operations Committee, that's for the House, and for the Environmental Health and Education Affairs Committee is in the Senate. And they really have to sift through all of those, and they need our help. They need our knowledge to help them learn, what's the right thing to do. Now, we don't always agree with every single thing that maybe another group would say about healthcare. Maybe it's something to do with corporate medicine, or maybe it's something to do with scope of practice. But in general, we work together to help the legislators to understand and educate them so that they can make the right choices, on behalf of doctors and all healthcare providers in the state of Maryland and the patients.
That's a good segue into my next question, and also we're getting a little bit closer to my students here. And my question is, who are the key stakeholders you must communicate with, and how frequently? And do you have a strategy for that, or does the organization have a strategy for that? You
Well,
kind of
it's
touched on it
really
a bit.
it's two-tiered, really, because part of it is to look at our health officers in the state, right? So we have our county health officers. So we have, okay, think of it this way: we have our county medical society components, and they obviously work with their legislators, right? So the legislators that are in those districts, like say the Baltimore County districts. And then we also work with the health officers, like the Baltimore County Health Officer or the Howard County Health Officer in our states. And those are important because they're giving us on the ground information. What's happening right now with the opioid crisis. How many people are dying in our county? How many overdoses do we have? We're getting that monthly. We're getting that information from them. So that's actually very important, because what we can do as outreach to patients, what we have to tell our legislators depends upon what our county officers can tell us. Then we have the Maryland Department of Health. So that's the actual state. We get information from them as well, and also from the Board of Physicians. And that's important because that's telling us, say, in terms of COVID, well, this antibody treatment doesn't work anymore for this new variant. We get the letters, so we get all that information. Then we can take that information and disperse it out to our members, so that we can keep on top of all the different things that are happening. So that's one part of it, is truly the medical component of it. The second component of it, obviously, is the legislative component. So who are the stakeholders? The legislators that are on the health committees, like the HGO I talked about, or the EHEA, are our House and Senate legislators that are on those, that are making that initial set of decisions about the legislation in healthcare that's going through every session. Now, we have to tell them and explain to them, what's the right approach and what's the wrong approach. They get information as well from other interested parties, and so it's important for us to kind of work together. And then finally, if that legislation passes through the House and the Senate, it goes to the full state, and then that's the whole General Assembly. And then we actually can talk to many members of the General Assembly, all of our legislators, so that they understand the issues at hand.
You actually answered my next question with with that, which happens frequently in these kind of interviews. That you've covered what I was going to ask next. But so this probably is recent, this next question. What has been your most challenging episode you were willing to discuss regarding communicating with the public, the state, or your stakeholders?
Well, I mean, probably what everybody's had has been the COVID, pandemic. It's just been a difficult time, because one of the hardest things was just really we did not understand as well as we should have the health disparities that we had in our state and across the country. There were so many groups in our state that weren't getting adequate health care, but it was sort of in the shadows. Nobody really knew about it, right? And then all of a sudden, when you saw that those people were, A, not getting the vaccine into their arms, B, dying at rates higher than people who did have access to good health care, we had that realization that, hey, the great job we think we're doing, it's not that great, and we need to do better. And we needed to also get that information to our legislators, to explain to them and to the Department of Health, like, we need a way to reach these people. And so one of the big things that happened in our state was telehealth. We had never been that crazy about the idea of telehealth. We weren't really sure, was it going to be good healthcare that people were getting? But when we had the pandemic and we couldn't see people, we had to do telehealth, which is over virtual computers and sometimes even phones, because a lot of people who have financial constraints or are marginalized otherwise don't have access to the internet, right? So it's going to just be the phone. And we had to make telehealth platforms that were HIPAA compliant and private, a lot of, things that would meet regulatory standards, but that could help doctors help patients. And in doing this, though, we realized, gosh, there are tons of patients who just can't get to their doctor. And that's not, some of it's financial, some of it's physical. The 80-year-old diabetic woman who has a foot ulcer may not be able to get or afford an Uber to get to her doctor to get that foot checked. She might not be able to get to her community healthcare center to make sure that her diabetes is under control. And if that's not under control and her foot ulcer gets worse, she shows up in the emergency room. All of these things could have been, it may not have happened if we'd gotten that diabetes controlled, right? So all of these things, all of the urgent things that happened depended upon the healthcare that they weren't getting. Now that also happened, then we saw it with COVID. They didn't get their vaccines. They had a lot of vaccine hesitancy. A lot of people have had a lot of vaccine hesitancy, and the education through telehealth mechanisms and other mechanisms. So that's been really challenging. I mean, that's been our biggest challenge over the last couple of years. And the information kept changing. I mean, I think people want to hear their doctors say, this is the answer. This is how it is. You should wear a mask. You shouldn't wear a mask. You should get a vaccine. You shouldn't get a vaccine. This vaccine works against this variant. It doesn't work.
You want clear yes and no answers to
their clear yes and no answers. And the problem is it's a new virus, and it's been changing. It's already changed 4 times over, right? Many variants. And therefore we weren't able to always give perfectly clear answers. We did the best we could. And I think that's been difficult. We're hoping that telehealth continues because those populations still aren't able to get, even after COVID's over, they're not necessarily going to be able to get an Uber either, or have the internet access and all of that. Broadband internet access would be very helpful. And I would definitely want for all of our Marylanders to have that.
Thank you. What advice? So most of my students all my students are public administrators. They're working on their masters in public administration, but their jobs actually most of their jobs are in the health fields or sports health. We have a lot of athletes in the program, but we have people working in community mental health or community health or nursing. But what would be your advice to anyone interested in joining the field, especially those who may not be physicians, but who might want to work for an organization like the Maryland Medical Society?
Well, I think, the state medical societies and community healthcare centers, I think, a lot of those societies, it's a matter of joining the society and wanting to get involved. For us, we did realize this, and this is another thing that happened because of the pandemic. We realized that a lot of people couldn't get to downtown Baltimore, right? In other words, if you're from Western Maryland, or even if you're from Annapolis and you have to drive an hour or 45 minutes, or you're working in any of your jobs, how can you get to a meeting, right? And some of us are able to get to meetings, but a lot of us actually now virtually can get to these meetings. So realize that joining doesn't mean you necessarily have to always be there in person. You can be there sometimes, but that we have a lot of offerings now for our state, at least. And I'm hoping that that's going to be the case with many other state societies and other kinds of societies, not just medical societies, but maybe societies of other, PA societies or, nurse practitioner societies that would have, virtual offerings and virtual meetings. A lot of our committee meetings now are going to remain virtual because we realize that just like we can outreach to patients better with telehealth, we can also outreach better to physicians and other healthcare personnel with, telework, telemeetings. It doesn't mean we don't want to meet together. And we are going to actually have our first virtual in-house House of Delegates this May for MedChi. But a lot of people can't make it. And still right now with the pandemic, it's not over yet, right? So a lot of people are still nervous. There are those who are immunocompromised or have family members who are, or who have children who haven't been able to get the vaccine. And maybe they don't want to be at an in-person meeting with 50 or 100 people. This gives them the opportunity to try to do that virtually. And just, getting involved, I found that just getting involved right at the ground level, hearing what people had to say, finding an area I was interested in, and then volunteering to give some of my time, that's how I moved up. It's moved up the ladder, but just no matter what you do, you don't have to become the president, but you can, join one of the subsections and work in that to do outreach to patients or outreach in whatever way you want to do it, with athletes or in the community health sector. Those are all important, equally important.
Yes, thank you. Thank you so much. I think they'll appreciate the advice on that. So I'd like to thank you for sharing your knowledge with us today. And on behalf of my students and the department, I would like to encourage my students to go to, is it medchi.org, or simply Google Maryland Medical Society. I found it to be a very informative website with very much transparent with a lot of good information. But again, thank you on behalf of the students and my department in the university, the Lincoln Memorial University, for your time today. And I look forward to posting this. I'll send you a link when it's done.
Thank you so much. Thanks for having me. Have a nice day.
You too. Bye-bye.